Newborns, their eyes are just so delicate and vulnerable, right? But it turns out that many of the traditional ways we've been taught to care for them can actually cause more harm than good. So in this explainer, we're going to walk through a really simple, evidence-based guide that swaps out some of those long-held traditions for clear modern science. This quote, wow, it just gets right to the heart of it, doesn't it? It highlights this really tough situation where practices that come from a place of love and protection can, unfortunately, be clinically dangerous. We're going to unpack exactly why that is and what the science says we should be doing instead. So, before we jump into the how-to, it is absolutely crucial that we understand the why. A newborn's eyes aren't just tiny versions of our adult eyes. Their whole anatomy, their chemistry, it's completely different. And that's what makes them so uniquely susceptible to problems. So, why is it that so many newborns wake up with those crusty, sticky eyes? Is it always an infection? Well, the answer really lies in two key features of their anatomy that together kind of create a perfect storm for trouble. First off, let's talk about the plumbing. I want you to think of a newborn's tear duct as a really, really narrow pipe. Its whole job is to drain tears away from the eye. But in up to 20% of babies, this pipe is actually blocked right at birth. So with nowhere to go, normal tears just pool up, they dry, and they create that sticky yellowish-white crust we see. This part, it's usually totally normal. Okay, now for the second piece of the puzzle, the conjunctiva. This is the clear layer that covers the white of the eye. And here's the thing, it acts more like a sponge than a barrier. It's what we call a permeable shield, which means it absorbs whatever you put on it, unsterile water, Kajal, bacteria from a finger, and takes it directly into the baby's system. So you see the problem, right? You've got a blocked drain where all this fluid is just sitting around, and you've got this highly absorbent surface with basically zero local defenses. This is precisely why introducing any outside contaminant is so risky, and why a sterile approach isn't just a good idea, it's an absolute necessity. All right, so now that we get the risks, let's get to the solution. And the good news is, this isn't about some complicated, stressful routine. It's a really precise, doctor-approved blueprint for keeping your baby's eyes perfectly safe. Step 1, and this one is non-negotiable. You have to make your own sterile water. I'm talking tap water, filtered RO water, even bottled water. None of them are safe for this. The rule is super simple. Bring water to a rolling boil for a strict 10 minutes, let it cool down completely, and you have to make a fresh batch every single day. Step 2 is the wipe itself. You dip a sterile cotton ball in that cooled, sterile water, and you gently wipe from the inner corner of the eye near the nose straight outward toward the ear. And here's the golden rule, you guys. 1 swipe, 1 cotton ball. Then you toss it. This is so important because it prevents you from dragging gunk back into the eye or spreading an infection from one eye to the other. Now, if the issue really is that blocked pipe we talked about, you can actually help open it up with a simple massage. With a clean finger, you apply gentle but firm pressure right on the side of the nose next to the eye, and you stroke downwards. Just 5 to 10 little strokes, about 3 times a day, can work wonders to help clear that blockage. And underlying all of this, the foundation, the single most important step of all, is just washing your hands. Before you touch your baby's face for any reason, a good, thorough 20-second wash with soap and water is your #1 medical shield. It's the best way to prevent transferring dangerous bacteria, period. Okay, now we need to talk about the cultural practices. And look, these things often come from a place of such deep love and a real desire to protect. But as we're about to see, the medical reality is that some of these traditions can be incredibly harmful. So let's unlearn them together. Let's start with the biggest and most dangerous myth applying Kajal or Surma. The reality is, it's a medical disaster for 3 big reasons. First, it often contains lead, which is a powerful neurotoxin. Second, the little carbon particles in it act like sandpaper, literally scratching the cornea with every single blink. And third, the finger you use to apply it, it just introduces a huge load of bacteria directly into that vulnerable eye. And let's be crystal clear about lead. There is no safe amount. 0. None. And because that eye surface is so absorbent, that lead goes directly into the baby's bloodstream, where even microscopic amounts can permanently damage a child's brain development and their IQ. It's a huge deal. But look, we all know that navigating family pressure can be tough, so here's a really practical compromise that doctors offer. If that black dot is culturally important, just place a tiny bit on the sole of the foot or maybe behind the ear. Anywhere it can't be accidentally rubbed into the eyes or mouth is a safe, respectful alternative.
Next up, the breast milk myth. You know, breast milk is liquid gold, it's amazing food, but it is also full of milk sugars. Now, if there's already a bacterial infection brewing in the eye, dropping sugar onto it is literally like pouring gasoline on a fire. You're just giving the bacteria the perfect food to multiply like crazy.
What about ghee or honey? Also a really bad idea biologically. Ghee is a heavy fat and it can physically block up those delicate little tear glands, which can cause painful inflammation. And raw honey, that can carry spores for infant botulism, which is a potentially fatal toxin. You just should never, ever put food products in a baby's eyes.
And finally, there's this one, which seems so harmless, right? Just blowing into a baby's eye to get an eyelash out. But your mouth is home to billions of bacteria, like staph and strep. When you blow into the eye, you're essentially creating a bacterial blast, shooting aerosolized saliva right onto that defenseless, super absorbent surface. Okay, so we know a little bit of crust after a nap can be normal, but when is it not normal? Let's talk about the crucial safety net. These are the clear clinical signs that mean you need to stop home care and call your doctor right away. Here are the 4 things to look for. First, the red sclera. That just means the white part of the eye is turning pink or red. That's a classic sign of conjunctivitis. Second, continuous pus. If it's thick, green, or dark yellow and it just keeps coming back minutes after you wipe it. Third, swelling. If the eyelids look puffy and red. And finally, light sensitivity. If your baby just can't stand normal light and cries. Any of these means it's time to call a professional.
So let's bring all this together. You know, the goal here isn't to create fear. It's actually the opposite. It's to empower you with knowledge. Your role as a parent is to be your child's most powerful, most informed protector. And that's really the core takeaway here. True effective protection for your baby's eyes doesn't come from old superstitions or cosmetic powders. It comes from understanding their unique, fragile biology and defending it with simple, sterile, and scientifically proven practices. And we'll end on this powerful note from Dr. Prashanth. Remember this when you feel that pressure to follow the old ways. You are your child's advocate. Your knowledge and your commitment to science, that is the ultimate shield that will protect their vision and their health. You've got this.